Hey everyone, how are ya? Good to see you. Thanks for making it through the day. My name is Neal Bloom. I run an investment fund called Interlock Capital. We're a fund of operators, meaning we have built platforms, software, hardware, and now we're investing in that and really kind of sticking to areas where we have been there, done that before, and using our expertise to hopefully help the companies as much as our capital can as well too. I am thrilled to have a really esteemed panel here of builders, leaders, and investors. They wear many hats, and so it'll be really exciting to get a lot of perspectives, especially in the frontier of digital health these days. Definitely can't have a panel without talking AI, so don't worry, we will talk AI. But we've got we've got people who've been building AI before AI was AI. So let me tell you, machine learning, we're gonna get actually real on the technology here. So without further ado, let me introduce the panel and then we'll jump right into it. Navid, why don't you jump right in,
Sure.
please.
Neal, thank you. Is working? Yes. Good afternoon, everyone. Navid Alipour, co-founder and CEO of two companies, sister companies, CureMetrics and CureMatch. We run them as one. They're separate entities, and I won't bore you with the details of that unless there's time. But before that, as Neal said, we started a small VC fund here in town called Analytics Ventures, which was the first AI-focused VC fund. Definitely here in San Diego, and we were doing it back in 2012 before anyone was talking about AI. So definitely we'll have a little bit to share on what I think about where we're at with machine learning, language learning models, and of course ChatGPT and everything else.
Awesome. Please.
Yeah. I'm Sujit Dey. I wear multiple hats, as Neal promised all of us do. So I am a faculty at UC San Diego. I'm the director of our Institute for Global Entrepreneur. Actually, my co-director is sitting right there, Amy. And I also love taking technologies, meaningful technologies out of the university, creating companies. So that's one of the things that I've done, like about 1.5 years back. So we have been developing, is this working?
Yeah, I think you just got to get close to the mouth.
Hello. It is? I think now. Hello? Yeah, it's working now. Yeah. So the technology that we develop is, we think will be revolutionizing not only in healthcare, but, many other things. And that is digital twins. So we are developing AI-based digital twins, and we have started doing it for patients. So any patient that is enrolled in our program, we create their digital twins, and the digital twin informs us very precisely what might be the issue that might be responsible for your blood pressure or your diabetes and so on. So we are extending it to various disease forms. And if you think about it, the digital twin is your living EHR outside of your clinics, outside of your hospitals. Of course, we are connected to the EHRs, but and using the digital twin technologies, we can predict, all of you have heard of continuous glucose monitoring, but we are developing technologies where it will be predictive continuous glucose monitoring. That is, it will predict beforehand, based on everything that it's seeing, based on your meals and everything, how your glucose response might be. So I'll stop here, and it's very exciting. Playing in the health field, very challenging also, and we'll get to those later.
Mm-hmm. Jay, please.
Hi there, I'm Jay Srinivasan. I'm the CEO at Truvian. So Truvian is a late-stage diagnostic company, or blood diagnostics, and we're based here in Campus Point. A simple way to sort of think about Truvian is we're a Theranos that works. We've done a ton of testing. Obviously, we had a huge sort of bar to kind of address, which is really about what had happened in what is much maligned blood testing. So we do a lot of, we obviously have done a lot of clinical studies and things like that, but we've also been out in like conferences like Health, HLTH, where we've actually put our product on the floor. We've given people the ability to walk, get their blood tests, and walk out with the results in their pocket. The Truvian platform itself basically will allow us to bring central lab quality results, but be able to do it anywhere you go. So think of it as corporate clinics, retail clinics, doctors' offices. You could walk in, you could get your blood drawn. We need 8 drops of blood, but we basically need 300 microliters of blood. If most of you understand what that looks like, it's a very small amount of blood. We need that amount of blood to really generate your annual blood test, and we'll give it to you in under 30 minutes.
Amazing. Awesome. Thank you. Last but not least.
Good afternoon, Shashi Tripathi. Here on the profile, it says I'm Chief Operating Officer with a company called Impedimed. As we have been hearing that we wear multiple hats. My background has been all healthcare, and I'm really privileged to work across all the pieces of healthcare. So as we all know in healthcare, we have provider market, so hospital and clinic. So I worked with Providence Health and Services, Springfield Clinic. Then we have health plans, the guys who are paying for our healthcare. So I worked with a company called New Century Health. We would take risk for Part A and Part B for cancer and cardiology. And then the life sciences, so Centute Medical, which is part of Abbott Health, Medtronic. During that time, I founded 3 companies. One failed, learned a lot on the failed one, but 2 had amazing success, one being used by roughly 20 million patients, and other is a remote patient monitoring for patient with pacemaker and ICDs implanted. I would say 80% of global cardiologists and electrophysiologists, they are using that product today. In October 2019, I started my own investment firm called Nurture Ventures. So I own a fund and SPV through which I invest into 4 areas: artificial intelligence, software as a service, so those 2 horizontal can go across any vertical. And then I picked 2 additional verticals, so digital health and fintech. I've invested, as of now, 32 companies. Thankfully, I got an exit, which gave me 7 times return in just 11 months. Very rarely it happens, but it did happen. Happy to be here, Neil.
Happy to have you all here too, as well. We're at an interesting time. It's always an interesting time in technology, right? But right now, AI is having its moment, 10 years, 20 years in the making. Yet healthcare moves at the speed of healthcare, right? And then it's built almost on purpose, right? So I'd love kind of like the macro perspective right now of what's your guys' take of just how rapidly technology is developing. So theoretically, the tools. What about our payers, our customers, and the regulations? Whoever wants to jump in.
I can take that. Is this working still? Or no?
Yeah, you just gotta go close.
Okay, so CureMetrics is our company we started in 2014. We're the first company in history to have an FDA clearance for an AI product detecting breast cancer. That was in 2019. The second clearance we got last year, CM Angio, is the first in history to detect heart disease in women from the same mammogram. So not to take away from breast cancer, but to detect heart disease earlier, 2 for 1, no extra radiation. This is what the market has been responding to. Now, we'll go to RSNA, it's a big radiology conference, we'll go to other ones, and we're having younger radiologists tell us that the older ones are working longer because they weren't making money during COVID. Mammography was not an essential service. And so now those that were going to retire have stayed longer, and they don't want to learn anything new. They don't want to try any new technologies and new products. So these younger radiologists are literally waiting for the older ones to retire. So that's just from the physician's perspective, right? From the payers, of course, they're, as an insurance company, I think the statistic is a covered life is a covered life for 18 to 24 months. And so there are certain procedures they would rather just kick the can down the road and not pay for if they don't have to, because they're like, well, we're not going to cover this person in 24 months. So they look to do the bare minimum. So there is that aspect until someone pulls the trigger and says, well, if you pay for this, for your covered life, to get a patient on a statin or to do an EKG or a stress test costs nothing compared to a heart attack, which costs $104,000 in the US to treat. So spend that little bit extra, and you'll end up not only delivering better care for your covered lives, but you'll also save money in the long run. So it's just some of the interesting dynamics we're dealing with.
Anyone else have a perspective?
Yeah, I'd like to say, being an AI company, see, there are various aspects of the use of AI. One is, what does it mean to the patients? The other is, what does it mean to the physicians who are, actually practicing? And the third is, what does it mean to the administrators, be it healthcare provider administrators or payers or, whoever they are. For the patients, so one of the applications of AI has been in diagnosis, right? Be it blood tests, be it, cancer screening, be it mammograms, whatever that is. But now think about it, AI AI would be able to say much more precisely what might be the relationship between whatever, something and something else, right? See, that's what AI specializes in, going through trillions and exabytes of data and figuring out certain things, which humans cannot do. So, so let's say, in a situation where you have a lot of care team members caring for patients, and they are really, really dedicated care team members. They are really dedicated physicians. And yet it will be impossible for them, human beings, to figure out very precisely what is going on. And that's where AI can excel. Now the question is, how would AI be used by physicians? And how would AI be appreciated and paid for by administrators? And Shashi, you had mentioned about this whole thing about payment, right? So that becomes now very important. Clearly there is huge utility, be it clinical decision support, be it patient engagement, be it precisely diagnosing what the issue is or predicting. And then the question is, who will adopt it, who will pay for it, and so on. And that story is being written, but I can say that we are an international company. We didn't want to, any of the companies that have started before, I have always looked inside US and outside US. And there's a huge market outside US. There's huge appreciation outside US. So when I just went to India, for instance, and not just because I'm an Indian. I went to India, I talked to a few hospital systems, and the reception for using AI there is amazing. And the same in Australia, the same in Singapore. So I
Is
think
that the healthcare level?
Healthcare level.
And regulation? How does
regulation
their...
is much, see, people are, I think, in many other parts of the world, people are more eager to adopt tools that can achieve much better performance, whatever that performance is. So because there's a panel to shed insights, my insight would be, of course, the margins here are much, much better. So you have to build a business for US, but reach out to the world and see the reception that AI is getting and the adoption that AI is getting. It's at a breathtaking pace, much, much faster than in US. So you'd be doing a disservice to your company if you're not looking outside. So the adoption is going much faster in other countries, but it is happening here. And there's much more trust building going on in US this year than the previous year, because every executive is now being forced to do something about AI. They cannot just not do something, right?
Yeah, so I'll offer my comment from two perspectives as a builder who built the products in the healthcare as well as VC side. From the building side, if you look into the macro view, in US, we are spending close to $2.3 trillion for US healthcare. That's close to 18-19% of our GDP. So huge opportunity, am I right? But when we are dealing with human lives, we have to be conservative. There's no way around it, by the way. And especially in US, yes, there are some parts of the country on a global basis may not have as stringent requirement as US is. And so if we launch any new technology, we are going to be slowed down, by the way. That's the reality. FDA clearance, if you're launching a product in med device, you have class 1, 2, 3. Depending on what class you belongs to, you have to do clinical trial. There's no way around. If you do clinical trial, you have to go through FDA clearance. There's no way around. Until you do FDA clearance, you cannot have revenue. Unlike any other product, unlike any other industry, you can launch a product and start generating revenue, but not in healthcare, especially medical device, especially drug. And these cost a lot of money, especially if you're dealing with direct patient care, am I right? Some of the admin-related activities, like scheduling, especially in the hospital side, dealing with some of the claims processing, and those applies to provider as well as payers, those can be faster. But anything, and I'm telling to the whole audience, when you're launching a product which has a direct patient care impact, don't expect it's going to happen tomorrow. It will take time. You have to have the patient and you have to plan for it. Now, from the VC perspective, there all kinds of VCs are there when it comes to life sciences and healthcare. Because of that reason, that life sciences, especially medical devices and pharma, it will take clinical trial. You have to get FDA clearance. There's no way around to it. I have decided, I come from that background, by the way. I come from life sciences. I have decided not to invest in that area. I do invest into digital health where there's no clinical trial, there's no FDA clearance. But there are VCs who are focusing very much focused on life sciences. So if you're creating a company into life sciences, look for those types of company. And coming back to your question, it really depends. In healthcare, what area you're targeting? If anything direct patient care, do not expect to have a result tomorrow. It will take time. That's the reality of the market.
Jay, with respect to, especially a hardware-focused business, like what is, one, let's take the prior question, like the hurdles. What are the hurdles, especially with Theranos already kind of set a high bar? But what is software doing? Is it sucking the air out of the room out of a hardware company, or quite the opposite and giving a different kind of barrier to entry?
Yeah, so that's a great question. I think as has been quoted, right, software is probably one of the most malleable aspects of human life today, right? You can do a lot with software, but you can't. I haven't seen anyone being able to run software without silicon. So if someone can show me that, that would mean hardware goes away. So until such time, I think foundationally hardware is very important, because the not the bar, but the barrier to entry in software has just completely flattened across the world. There's honestly, software to me, and I have a background in software, but software to me, it's a commodity. And so the only way you're going to drive growth is through hardware. And the way to do that is to really build the right pieces of hardware that will really be able to take the value that software, AI, and everything else that you build on it, that stack, that full stack, and its values only can get created through hardware.
Love that. Anything else respective to kind of regulation-wise that's good or harder for you as a hardware company also as well now?
Yeah, I mean, I think you heard from all the panelists, right? I mean, I think the bar for healthcare is always going to be high, like any other regulated industry. And you just moderated on fintech, and it's about the same, right? The bar is high, much higher, because the cost of human lives is obviously high. But I think what needs to happen is the diligence that goes into any device has to start from every aspect, from the user experience, the requirements, what the market needs, to how you really build the hardware components and the software components that follow it.
If I could add one
Please.
thing that Jay reminded me of. So there's a saying that the law is always going to be behind technology, right? Whether it's fintech and crypto or in healthcare and AI. So the law is always going to be playing catch up, and then it's there to protect us and mitigate against the bad actors. And there are bad actors, right? And that's another thing with AI. AI is a tool. It's not good or evil. It'll be used for good, and there are many who will try to use it for bad purposes. And our job is to mitigate that, and it's never going to be complete, right? Just like the automobile when it was invented, people said, what's going to happen to people that are, taking care of the horses and the buggies? They're going to lose their jobs. Well, they did, but look at all the jobs that were created. And you look at the automobile, how many people have lost their lives or have been hurt? Many. But all in all, the automobile is not good or evil. It's a tool, and it's had benefits and horrible consequences, from pollution to people dying. But AI, that's how I think of it. It's a tool. It's not good or evil. It's here to stay, because, in my opinion, 3 reasons. We have higher compute capacity, we have the cloud, and we have more data. And for those purposes, we're making the advancements that we are. And it's incumbent upon us as the good actors, and the regulatory hurdles are unfortunate in some ways as a company. I feel it with the FDA, for example, but once you get over that clearance, then it's a barrier of entry for others. So there's 2 ways to look at that.
Yeah. I think that I'd just like to add one thing. So as Shashi is saying, that anytime you are developing a medical device or anything that is touching patients, you have to go through rigorous trials, no exception, right? So that, I think that any entrepreneur in the room will welcome that. That trial might take 2 years, 3 years, and then you have like 1 year to get into any health system. Any of you who have tried to get into health system, it takes about 1 to 2 years. That's all good. But what we are talking about is also a mindset. And that mindset sometimes can encourage adoption, and a different mindset can be, sort of more risk averse. And it's very interesting that with a lot of innovation happening in US, and of course, if you're an entrepreneur, you'd like to figure out, so as I figure out the adoption route through the payment system and things like that in US, where else will I look at? And that would be something that, you'd be amazed if you are not figuring that juggle out, that puzzle piece out. But here, I'm seeing the improvement in the atmosphere of adoption in AI. Like when you would fund your companies, when you had a investment fund, and today if you are funding, the pace of adoption by healthcare providers, by clinics, by individual physicians and so on is picking up much more in US.
When we were investing and started Curemetrics in 14 and then CureMatch in 16, there were hardly any investors that were investing in the convergence of the life science and healthcare and software. And the tech investors were afraid of anything that the FDA touches, right? And the medical device, life science investors were afraid of anything that is software and AI focused. So now there are more educated investors and it's a more mature market. But in 10 years ago, there was hardly any.
I want to double down on that, between you and Shashi, that 10 years ago, you made a broad spectrum fund bet across AI everywhere. AI is going to be everywhere. And then a few years later, you went double down into healthcare. Yeah. You personally. You're like, all right, I have this fund, but I see, obviously, you kind of said with your actions, I'm going all in on healthcare. And you, who've had a lifelong of healthcare, building companies, saying, I'm not investing in healthcare. I'd love to just talk a little bit the difference here. Navid, why don't you kind of start in that regard?
Sure. So we did make investments outside of healthcare, and so I'm on the board of those companies, and some failed, some are doing well. I focused on healthcare because I was personally passionate about it, right? And these were the two we had started first under that venture studio model, and we didn't even know the term, right? We met the scientists. They didn't have a business plan, no business model. They just said we're these rocket scientists. We did work for NASA, for Los Alamos, and we looked them up. They're legit, and we said, look, we're in San Diego. Healthcare or defense, those are the two competitive industries in our opinion, and we went with healthcare. And so I think that, to Shashi, you said 20% of the US GDP, right? And all this money that we spend, we don't have better health, but we have the talent here. And so we think that it is going to drive the 21st century. It's not going to be easy. It's much easier to create an app to walk your dog or deliver pizza or, find a date, but we wanted to do something important.
No, so I don't invest into medical device and pharma simply because it takes a long time for them to realize revenue, because they have to go through clinical trial and FDA clearance. Now, once they do get to that stage, it's 20% of our GDP. It's a huge opportunity, by the way, but it takes time, and I don't have time. That's my main reason.
So it's like a diversification. You're working in the industry, but you're investing elsewhere.
Exactly, and I do invest in digital health. I invested in a company called Luna Joy, by the way. They are in women's behavioral health. And they have clinical services they provide for women from adolescence all the way to menopause, going through the whole cycle of the women. And they are doing so good. I'm very happy with them, by the way. I invested at 15 million valuation. They just did $40 million valuation raise. Y Combinator invested $4 million at $40 million valuation. So I do invest in digital health where it does not require clinical trial and also the FDA clearance. I often say, because of my background in med device and pharma, from the VC perspective, if any one of you are thinking to start a business, startup in med device or pharma, the first thing you should look for is the reimbursement. And I often say to my VC friends who are in this area, I want to see the first slide of the pitch deck. What's your reimbursement strategy? Because in US, doesn't matter. I know a founder, by the way, and she has created wonderful technology for children, and we all know, I have kids. Kids get earache, am I right? And because of earache, we have to now make an appointment, get antibiotic. It takes time. She has created this simple tool you put in the ear, and it transmits to the provider, and provider can immediately respond, but there's no reimbursement for it. Now she's struggling. Now, from the society perspective, it's a good thing. But from financial angle, there's nothing she can do, and she is struggling to raise the fund. So what I would say to all of you, if you're starting a company, and by this, it's a reality, it's a hard reality. That's our government. That's how payment works. I cannot go change the payment system. What I can do is in that construct, in that constraint, what can I do to make the success? What can I do to make a dent? That's where I'm coming from.
Jay, can you comment on that? Just kind of your commercialization strategy, because there's a few, right, for how to get on-demand blood results.
Yeah. So, so basically, what we have is we've taken the entire suite of testing that's possible at a LabCorp request, and we've just sort of remastered it in our format. So from a reimbursement standpoint, the pathway is sort of clear for us. We're using the same panels that are getting reimbursed today. We just have a different form factor in how we can reimburse it, because we can just do large panels at the same price point that, that today would happen for small panels. So just we've addressed cost, we've addressed access in how we're thinking about the problem, but then the convenience and sort of the cost allows physicians now to actually make money. And physicians, as you know, lose money. The biggest thing I wanted to point out, which really, we talked about the GDP and the cost of care and so on, but adherence is one of the most important problems, right? I mean, about 140 million Americans actually do not adhere to their blood test order. So that means about half of them are walking around with some sort of chronic condition that they don't know about. And that's why you see this disconnect, right? This 80-20 rule is broken for healthcare. 20% of the US population costs 80% of the money that goes into healthcare today. So if we can solve that, if we can sort of dislocate that part and bend that cost curve, I think that's foundationally how we're going to change it. And that's why you need things in the digital health space.
Mm-hmm. Amazing. Well, we're getting up here on our end here. I'd love to, and we could talk for hours. So if you'd like to stay and ask some questions, we'll take that out into the halls. Any hot takes? Where do you think we'll be in a year, or a contrarian view based on what we're seeing right now in digital health?
I'll go on this one because, look, I always say this, Navid invested when no AI investments are really there. I did AI when AI was not cool, okay? We've dusted 60s literature around sort of neural nets and so on. Computing's gotten there, the problems have changed, and data is just gone. But it's really what's going to need to happen is you really have to find and target the right problems you want to solve. Otherwise, Navid's solving some very interesting problems, right? Those are problems that need to get solved, because otherwise this just becomes a tool, and you take this whole notion of everything looks like a nail when you've got
a hammer.
A hammer in your hand, right? So I think that's what we got to get around. And the biggest thing about digital health is, are people going to actually do something? It's not about giving more information, right? And I say this almost like as a joke, but I mean it, and it's a little flippant, but I always say big data exists because good data doesn't. And foundationally, if there's not knowledge given to a digital user, they're gonna do anything about it.
Yeah, I don't know whether I'll answer from a contrarian point of view, but if you look around, and I'll be saying this not from a medical device perspective, because that's a perspective I don't have, but if you look at the caregivers in any hospital system, even within insurance companies and so on, the biggest problem that they have, the administrators, is staffing problem. That's a huge problem. And I think that AI is going to, and I don't say this lightly, it's going to change how things are administered, the care, everything that goes on in a hospital system or in an insurance company. I'm seeing the beginning of the changes, and things will be radically different in the next 5 years. There's another big thing that is going on, that is concierge service. So if you look around in any big city in US, including in San Diego, things are popping up, these concierge services, which is directly challenging the payer system. There are a lot of providers today, I'm talking of individual practices and so on, which are refusing to take insurance. This is not necessarily good for the society, but for digital health, it's a huge opportunity. So this is also going to disrupt in very interesting ways, and I don't know exactly all the things that are going to happen in the next 3 years, but I'll say that we are at the cusp of big changes.
Anyone else, or you want to end it there?
Go ahead,
I was just going to, very quickly, there used to be a company called Blockbuster, if anyone remembers, and another one, Barnes & Noble, big companies, right? And these little companies took them out because they were arrogant. Barnes & Noble could have bought Amazon for nothing, and there's a documentary on it that's horribly made, but it's on Amazon, and you can go watch it. But they didn't, and I think healthcare is a little different, but not that much different. With the regulatory hurdles there, it's going to take longer, but it's happening. Oracle bought Cerner. It was a $28 billion purchase. It's been a disaster, but they're committed, and they're not giving up on what they're doing. And to Sujit's point, I think that there's more and more concierge medicine. People are willing to pay for good health care. Before, you would say people spend more on their dogs than their own health care and complain about copays. I think that's changing. And it takes some time, but it's happening, and then it goes. I think we're going to see an inflection point in 5 years.
AI can bring the cost down.
Exactly.
So for concierge service to be successful and get to the broad base, the costs need to come down, and that will happen in the next 7 years.
Okay. Thank you. We'll end it there. Thank you all very much. Appreciate it. Get a hand for our panel.